Hello, my friends. This is Dr. Diana as patient, and I am pretty ill. It is finally time, my friends. I have been so excited to get treatment trials started for those of us with chronic invisible illnesses. So heads up, folks with Ehlers-Danlos syndrome and dysautonomia, or joint hypermobility and dysautonomia, multiple sclerosis, chronic Lyme disease, chronic fatigue or ME, fibromyalgia, chronic painful endometriosis, and rheumatoid arthritis. We'll start with those, okay? While the attorneys are working in the background, we are starting preliminary testing. And by the way, it takes my breath away by how many attorneys are needed for this. Heavens. But Joe, my attorney, he is my hero. My friends, when you need a good, honest, strong, compassionate, and powerful attorney, they are worth their weight in gold. Thank you, Joe. So in the interest of survival and pushing things along, Pretty Ill is joining up with Total Eye Care to start the preliminary testing so that when the attorneys say go, we can go. Many of you all know that Total Eye Care is the eye care practice that my husband and I started before I became ill. So we have a building to work out of to start the testing. If you go to www.totaleyecare.com and look for the Colleyville, Texas location, that's where we will conduct the preliminary testing. And yes, it's in the Dallas-Fort Worth area, just 7 miles from DFW Airport. You'll want to allow for about a half a day or so at the office. We'll start with 5 to 10 patients per condition. Sound good? Testing at this stage will involve a questionnaire, perhaps a fundus image, a picture of the back of your eyes if we don't already have one. We'll review some common blood work that you've already had done. Then we may have a physician and a phlebotomist with us to draw a vial of blood. That's not bad, is it? Then you will be in the queue for treatment trials. When the attorneys say go, you'll already be ready. This will save us a lot of time. Now the schedule for conditions to be evaluated, this is all on the website, okay? October 8th, Monday through October 19th is EDS, or joint hypermobility with dysautonomia and multiple sclerosis. October 22nd, Monday through November 2nd, Friday, chronic Lyme disease, chronic fatigue or ME, and fibromyalgia. November 5th, which is the Monday through November 16th, the Friday, chronic endometriosis and rheumatoid arthritis. Now, you can find all of this under articles and handouts at prettyill.com, okay? Please go to the forum at prettyill.com where I'll have threads for each one of these conditions. If you have overlapping conditions, just pick one. Let me know your diagnoses and the week that you're interested in participating, okay? I understand this puts people who are not in Texas at a huge disadvantage, but I just can't be everywhere, my friends. Even if you can't participate in the preliminary testing, now we can only afford so many folks after all, I will put you on the list as being interested in treatment trials, okay? Please be patient as I'm working as hard as I can, but I just haven't been able to respond to folks individually lately. Usually doctors would have tons of people working with them on this sort of thing. We don't have that luxury, and it would add so much to our cost. Just please be patient so that we can put any money raised right into testing and not into administrative expenses, okay? Now, most of you know that I've been on professional disability now for 9 years and have basically worked for free. It is culture shock going into the world of well-paid attorneys who use terms like small retainer fee of $10,000. Yikes, my friends. We will put our heads together on fundraisers later though, okay? But please get those wheels turning if you can. We will need all of your great minds on this, and we are all grateful to you for helping. Meanwhile, who wants to wait 2 to 3 years for potential yet unlikely NIH funding? No, me neither. As patients, we know the potential misery that makes every day and sometimes every hour critical for us, right? As a patient, I began with describing my hyperadrenergic episodes as feeling like I was being electrocuted and poisoned at the same time, which is interesting because I'd never been electrocuted or poisoned, but it was the only way I could describe it. And as the dominoes fell and symptoms changed, it began to feel as though I was being eaten alive from the inside out. It's another horribly difficult symptom to try to explain, but as fatigue kept me down over 20 hours a day, I could find no comfortable position, even in bed. I was freezing and sweating, freezing and sweating. And then the pain became overwhelming. I, like many of you, felt that I didn't have time to wait for slowpoke science. So my husband and I are paying out of our savings to get this started. What I'm going to do is post all of Pretty Ill's financials for you right on the website. I think transparency is important, and I can't tell you how many patients think that I either have really deep pockets or am somehow getting paid. No, this may seem crazy. This is not the way things are usually done. But science is changing and needs to change, in my opinion. So much of what I was able to figure out was pushed along by you, wonderful folks, who opened your hearts and your lives to me, explaining your symptoms that most doctors thought were nuts, right? The use of social media, by the way, is a very underutilized way of getting a lot of answers quickly, and I thank you all for reaching back to me as I reached out to you. This will continue to be a joint effort, my friends. I truly believe that if we get answers out there, the money will come. Thank you for any help you can offer in that regard. So I can hardly wait. Please let me know your interest level through the forum at prettyill.com. We'll use that as our hub, okay? I'll circle back with you as soon as possible. Again, testing will begin October 8th. On Monday, okay? Now, I know how hopeless our conditions have felt, believe me. For EDS patients and chronic fatigue and fibromyalgia patients, please know that I could not even turn my head without feeling like I was passing out. I wore a cervical collar most times for almost 2 years. I was told I needed numerous cervical surgeries and a brain shunt. I remain blessed to be surgery-free today, and I'll leave you with this image to give you hope. Let's continue to change our world, one brain cell at a time, if we have to. Gentle hugs to you all. Hit it.